Good evening, ladies and gentlemen. Thank you for joining me for another episode of Campbell Talk. And today we have with us Miss Linda. I'm gonna mess up her name, Clarnoid. She's gonna say it when she come on, but we have her on with us today. She is a very knowledgeable source in our community, and we're here to talk about HIV and the Haitian community. And all of this month into next month, we'll be talking about like Caribbean populations and um, Haitian community and how we can kind of like address HIV and discuss HIV in a way that's more meaningful and engaging for everyone. So, without further ado, we'll be right back. Welcome.
Hi.
So I totally butchered your name. So can you tell us? Can you pronounce your last name for us?
Of course, Clay the Nord. Clay the Nord. Okay.
Lay the Nord.
Of course, it's French. I'm Haitian. So Clay the Nord. Can you repeat Clay the Nord?
Lay the Nord.
Yes, you got it.
I was like, Chloronoid.
No, you did good. You did good. Not too
Thank
bad.
you. Well, thank you
hmm
for being on the show. We really appreciate you being here. And I'm just gonna give you some time right now to tell us about yourself.
Okay. Hi, everyone. Like Richard just said, my name is Linda Clay the Nord. I'm Haitian. I'm sure you can tell with the accent. I grew up in Haiti. I came to United States as a teenager and went to Florida. Oh, I'm sorry. I have a dog. I have a pit bull. I'm sorry. I'm sorry. I don't have a studio, so forgive me. I'm so sorry. Someone is getting him. Okay. I'm so sorry, audience. Hold on. Let me go to. Okay, okay. I think he's down. He's come. He's come now. I'm sorry. Don't do that. I'm sorry.
Sounds like he wants to be on the
Oh
show.
my God. He should have gone to daycare. I'm sorry. I'm trying to. Oh my God. Let me go out of the. So you don't really hear the noise. Oh my God. Can you still hear him? I'm at a different. Can you still hear him?
Yeah, but not as loud as before.
Okay, okay. It's a pit bull. I'm so sorry, guys. Yes, so I came to United States. I attended Florida Atlantic University.
Uh-huh.
I majored in finance. I have a bachelor's degree in business administration. Then I'm not going to give my whole life story, but I I started working at the health department in the HIV program just by accident because I thought that job was going to be just a stepping stone for me to just work there for a while because of the stigma, and we all know how people think of HIV AIDS. So when I
Yes.
had that position, I said, okay, just going to be for a little while until I can get into what I really wanted to do. And I just after just working my cases, meeting people, who are living with HIV, and meeting people in the community, I just fell in love with the field. I really loved it. So because especially in my culture, how people view HIV, how people view the diagnosis. So when I first started, when I would meet with people and I explained, this is not, this doesn't have to be a death sentence, and it's not. We have medication. If you don't have insurance, we have programs that can help you. And the way they will respond, so I stayed. I'm like, no, this is it for me. That's it. So I really enjoy what I do, and I really enjoy meeting clients, meeting people in the community. So together, we work together, we educate our client, we learn from our client, and now we're looking at possibility, a possible cure, because I know someone who is going to that trial right now. So you never know. We're working towards ending the HIV epidemic. So yes, that's my story. I just summed it up. I didn't really say to I really didn't get into detail. I'll let Richardo ask me questions, specific questions.
Okay. Well, thank you for being on the show tonight. And
My pleasure.
so, one of the first questions that we'll go ahead and just to kick off and go ahead and get started
Mhm.
is, what do you think it will take for us to end the HIV epidemic? You can speak about it broadly, or you can even, in some cases, pinpoint it around, like the Haitian community, if you will. So, what is it? What will it take for us to end the HIV epidemic?
Well, in my opinion, I'm thinking prevention, education, because people don't talk about HIV. As you know, people don't. Especially for me, when I needed a job, and as soon as they say, well, you're going to work, with people who are HIV diagnosed, I almost didn't take the position. And I needed a job. I didn't have a job. See, because we never talked about it. Never. We never discussed it. That was when 2015. We think when you have HIV, that's it for you. People don't take the time to educate themselves, to find out what are available in the community. So I'm thinking prevention. By prevention, testing, educating, make treatment available, because right now we're only thinking about, can we say um programs name, like, can we say Ryan White program? Is it allowed? Yes.
Yeah.
So right now I'm only aware or been working with that the county that provides the Ryan White coverage, the NOE, for clients who do not have insurance coverage. Okay. So if we can create more program like that, with fundings, with grants, to get, to offer, to make care more, I mean, to make care, what's the word for it?
More accessible?
Accessible, that's the word. Yes, I think that would really help us. I mean, we don't, that would help to really end, it would contribute to, ending the epidemic. So my two things are made, prevention, education, and prevention includes testing, okay, and treatment, and finding clients who are not aware of their diagnosis, because we do have that too. We have so many clients that are, sometimes people are people are testing through life insurance, right? And
Right.
they didn't just go and um request an HIV test, right? So when they go in, that they get tested, it's kind of hard to find those people because they didn't know. It's kind of hard to find those people to, to give them the result, to educate, and to offer treatment. Okay, so you know if we could have, I guess we're working towards that now, but have more programs that would look for people, guess work with the health department, you know, find a way to reach those people who were tested, and then they don't have, they never even heard of the result, don't know, so they can't really go to start treatment. So that's what I would say.
Do you foresee any barriers with ending the epidemic? Like I know you mentioned prevention before, but do you see what kind of barriers do you think will be there for people who may say, you know, I want to do something, but they might have barriers? Do you know what kind of barriers those might be, or how they can prevent that from happening?
Oh no, we had a breakup. I didn't hear what you said. I didn't hear the whole question.
Okay, so the question is, what kind of barriers do you see or think there might be towards ending the HIV epidemic, whether from a cultural standpoint or just from a general standpoint?
Well, cultural. Again, people do not talk about about HIV when they go to their providers. They do not ask, for a test. Okay, so barrier will be sometimes, language barrier. Okay,
Right,
I can give you specifically. I have even my own parents, going to providers. I mean, and providers, they don't have someone who speak that language. And I'm not only saying, well, we're talking about the Caribbean. Let me focus on um, for Haitians. Is that okay?
that's
Like
fine.
my culture, that's what I know, my culture. Yeah. So
Absolutely.
yeah, so at providers, people want specific, it's something specific, even if they use, there's a service that called the language line. People who are working at the language line, they do not, they some were born here, certain things they can translate efficiently,
Mm.
so let's just say language barrier when we're trying to educate people about HIV, about testing. I think that is one of the barriers. Again, we have transportation. Some people are, they do want to get to care, they do want to start treatment, but then again, they don't have a car, right?
Right.
And some people, not only not having a car, even let's say, okay, I can give you a bus pass. Some people don't even know. I mean, in our community, they don't even know how to take the bus, how to go to the bus stops, where to stop. And I'm not sure, you might not know because you might not ever taken the bus before, but you have to know where you are going. We have what was the first thing that I said? Language barrier.
Mhm.
Okay, that could potentially cause, be a big problem, and to, not getting to people and not understanding, what the disease is, what they are dealing with. And then the people that who really are already in care or need to start care, transportation. And then, we all know, um, some of our people, they don't even when they have that, they don't even want to share that with their family or friends, due to the stigma. Okay, because and we know, you can say, okay, I'm living with this person, let's say friends or cousins or even husband. You might feel safe, some people might feel safe to talk and say, okay, this is what I'm dealing with. This is it. When you have a community or when you have people to help you, I mean, I guess things will you'll do better at anything, right?
Yes.
Okay.
Absolutely.
Yes, so now, because of how this subject is in our community, people don't even tell even their own parents. Okay, sometimes even their partner. We're living with, they are living with the partner, they just find out their diagnosis. It's they're just so scared because of how we perceive this in our community. So I'm guessing, again, education. I mean, we have to create or figure out a way on how, to get to, thinking churches. because our people go to church a lot. You know that,
Absolutely.
churches, clubs, you know, and to really put some program together and educate and talk to them. I'm just talking. I don't know. You stop me
Yeah.
when
No,
I'm talking
absolutely.
to.
I mean, you hit very valid points. You hit very valid points. So, you mentioned transportation being one of them. And
Mm-hmm.
it's not even a matter of like being able to take the bus or whatever, because, I grew up in New York City. Um, so I'm used to, just jumping on the bus, jumping on the train, getting to where you want. Like, you can get from like the Utica Avenue station, which is the start of like the number 4 line, all the way to the end of the 4 line, which is all the way in the Bronx. So it goes through like 3 counties, and you can get all the way there in like 45 minutes to an hour. So it's
Mm-hmm.
when you think about, and then there's like twice as many stops as the tri-rail has between
Mm.
here and Miami, and it takes what, maybe about 2 hours to get from here to Miami. So
Yeah.
and then
Mm-hmm.
also depending on the bus, it's like the bus is not efficient, and the bus is
Yeah.
not, it's like I've gone out and I've seen people standing at the bus stop, and I've come back like an hour later and people are still
They're
standing.
still there.
So it's
And
not convenient. It's not usually user friendly, you know, but
and sometimes they don't even show up. They don't even come to the, the buses don't even make it, due to, like probably have some problems, or the whomever was driving the bus didn't show up. So, yeah,
yeah, and I
they
and I
can't really rely on public transportation
right.
that
And I,
much.
and I know many other cities have different infrastructure in place, so it helps. Like I know, like in New York City, when it's rush hour traffic in the morning and in the evening, they put more buses on the road, right? Because they want people to be
Hmm.
able to get to where they need to get to. And
Which
then
is good.
in the in between times when it's like not as busy or whatever the case is, the non-rush hour time frame, then they kind of like pull back on the services a little bit. And then
Hmm.
they look at the times when people are going to be out and busy and all this other stuff and hanging out, and that's when they put more transportation out, because they want people to utilize the train and the
The
bus system.
service.
So this
Hmm.
way, less people driving drunk, less people,
Hmm.
like, you know, having a hard time
Good.
getting around. And that's why people make decisions to drive anyway. And so
Hmm.
if the bus system and the train system was more efficient, then yes. And so sometimes when clients show up, they don't have people who speak their language. Uh,
Hmm.
and sometimes it's not the best. um and you can't, and it's really not appropriate for for people to be asking their kids or their the family members to translate for them. I mean, some of it might be sensitive medical
Of
information.
course. Of
And
course.
like I see, like, because people don't have the resources, they use their kids to translate for them a lot. But in a medical system, in a medical service environment, that is just highly inappropriate. It can be very scary. I mean, that is essentially you're telling a child a
Of your
thing
life.
to tell their
Personal.
parents.
Hmm.
Yeah.
Yes, you're right. You're right.
And, and
Yeah,
of course the education piece, and the education
yeah.
is always going to be important.
And can I also say, even using the language line, um, we do give HIV results.
Mhm.
Okay. Well, I'm fortunate in my program. We have Spanish speaking, and then myself for Creole speaking clients. Some agencies, they do not have that. They don't have, or maybe that person just quit. They have the person Creole speaking or Spanish speaking that just quit, or any other language. I had a, a Chinese client who spoke Mandarin.
Mhm.
Even when we Mandarin, yeah,
Mhm.
that's the right.
Yeah.
Even when we call the language line, it takes some time to even find that translator that can speak that language. Imagine you want to give someone a result, right? Let's stay with the Haitian community. You call, it's about their test, it's their medical history you're going over. And You make that phone call, that person identifies his or herself, I'm here, and the client's there, three people, and you're giving that result, with that person translate it. You see what I mean? It's so difficult. And the person sometimes they don't want to hear, they can just decide just to leave. Okay. When I have someone in front of me, that can help, or I can speak and understand, have a normal conversation with, then I can come back. You might lose that person, okay, while you have that person right there. So I'm thinking that you know bilingual staff, that to assist their clients, because it will, I'm telling you from experience, when you are talking to someone and someone, you don't know where that person is over the phone translating, that person doesn't feel comfortable telling you, the thing that you will need to help them with their care. So
Absolutely.
yes, yes, one of the barrier, language. Like I said, I mean there are plenty, but as I'm sitting right now, those are language, transportation, you know, those are the two that just stand out.
Absolutely.
Hmm.
Um, how do we motivate or inspire people to go get tested?
Again, education. you know, Everything falls into you have to educate, explain to the person, why you need the test, why you need to be tested. Because if you don't test, you will not find out, you know if you have anything, right? We're talking about only HIV here, right?
Yeah,
If you don't test, that's the only way you would know whether or not you are infected, is by testing. I know some agencies use incentive, for some population, for some segment that might work, okay, but for other population or other segment, I guess it's educate the person that, hey, you need to be tested. Isn't it required or recommended that if you are sexually active, you test every 3 months or 6 months? what
yeah.
what is the
Every
standard?
well, it depends on how sexually active you are.
You are okay. No,
So
I
if
thought the standard was like three months or six.
every 3 to 6, they usually say every 3 to 6 months, depending on your level of risk.
Okay, that's what
So,
I thought.
so I think on average, though, like every 6 months, if you're definitely having multiple partners, if you're definitely having unprotected sex, you should definitely be seen. And in some cases, it's kind of like every time because we have people who are um, serial monogamous
Mm-hmm.
people where
Mm-hmm.
they'll date for like 3 months and then they'll break up and go date somebody else for another 3 months and they'll
Mm-hmm.
break up and date somebody else and it's just
Mm-hmm.
constant. So in
Mm-hmm.
that particular case, it's like a good rule of thumb is like every time you end a relationship or before you start a new one, you should definitely get tested.
You should get tested, and even when you test, we tell you also, there's an incubation period. You might have gotten infected, and when you take the test, depending on how early you were infected, it might not show. So you have to consider the incubation period too.
All right. So this is the part of the show. Well, let me show this up here. So for those of you who might be watching it, joining us now at this time, um, we have Ms. Linda on,
Hi.
and we've been talking with her about HIV in the Caribbean population, specifically around like Haitian community because she is Haitian,
Yeah.
and she is a very very knowledgeable educator. Um, she just happened to
You.
fall into HIV, right? Just fall into
Yes.
the whole HIV work,
Mm.
and she's loved it ever since. So
Yes.
so
Yes.
we're really excited and happy to have passionate individuals and people, and specifically people who are just really super passionate about the work that they're doing and about the communities that they serve. And so if you we do have if you need to at the bottom of the screen we have our number up, 561-208-6595. If you want to get a free HIV test, you can call and schedule your test today. um, what else is here? Everybody should get an HIV test. So whether
Mhm.
even just part of your annual checkup, you should go get an HIV.
Mhm.
So at this time, we usually pause and do an education moment here, but I'm going to ask Linda to participate in this education moment because I would like to say it in English and I would love for you to translate it in Creole. So this way, when
Sure.
a person is
Sure.
watching this and that's their preferred language, that to understand. So
Okay.
here we go. HIV stands for Human Immunodeficiency Virus.
VIH, putting me on the spot, on the spot here. VIH is a VIH. Well, I can say what the word is in Creole. When you say VIH, that is the HIV.
Okay.
So VIH, say virus. I don't know how to say that in Creole. But when I say VIH, my clients know what it is that. It is HIV. But
Okay.
God.
Yeah. Um,
Sorry.
HIV is not transmitted from hugging, kissing, using the same cups, plates, forks, or using the same.
When you are using a translator, you shouldn't say that. You have to give the translator time to translate.
All right,
Okay.
all right, all right. Here we go. Here we go. Here we go. We're trying this again.
Okay.
All
Go
right.
ahead. Yeah.
HIV is not transmitted.
Ou pa ka pran VIH. Go ahead.
That was so
Mhm.
short.
I know. No, you can say, you can go ahead.
Okay.
Go
Okay.
ahead. Go ahead. I'll
Um,
tell you when to stop.
from hugging, kissing, using the same plates and forks,
Ok. Ou pa ka pran VIH nan embrase, bo, epi utilize menm gode.
or using the same shower or toilet.
Ou bien utilize douche à bain ou bien toilette.
The only way to know that you have HIV
Seul fason pou konen ke ou gen VIH,
is to get an HIV test.
se pou al pran yon test, se pou al teste.
If you are HIV negative, you can get PrEP.
Si ou pa gen VIH, ou ka pran sa yore le PrEP. This will need explanation, the PrEP part. I'll need to
Go ahead.
extend that part.
All right, go
Okay,
ahead.
so PrEP, ki sa PrEP ye? Son medikaman, men medikaman
I think
ok, li ka edo money. What's that again in PrEP? What's that? Uh-oh, bad connection. What's the accuracy rate in PrEP,
it's
Richardo?
over 99%. 99%.
90 over 9. Okay. Li, li, li gen accuracy de 99%. Ok, lò pran ni ti gren sa le do pou pa infekte l potejo, pou pa infekte. Me yo stil rekomande pou utilize proteksyon tan ko kondom, fò stil utilize l pou si moun nan gon lot maladi. Ok? Go ahead. I
All
had to
right.
explain the whole thing.
And if you are HIV positive, then you can get into treatment and get care. You can explain all of that.
Yeah. So that's what I do. So yes. Si ou teste positif pou VIH, gen traitement qui valable pour, qui available pour, qui valable pour. OK? De pour fin traiter ya, ou met pas de assurance, ou met gen assurance, gen programme qui pour aider pour qu'elle prend médicament. OK? De pour al kay docteur ça nous fait yo tester yo fait lab pour de pour rive yo tester ou yo ouais niveau nan ou même et puis yo tout bon médicament. OK? Programme ça le test and treat. Yo tout bon yo tester et pour traiter. Yo bon médicament. OK? Kounya sou pas gen assurance, nous gen un programme, c'est ça que le Ryan White là. Nous gen un programme côté ou aller yo mando quelques documents qui prouvent que ou rete nan Palm Beach la, OK? Et ça la VIH, OK? Tout docteur pour un docteur pour un bon médicament et puis pour faire lab la paye tout bagay ça. OK? All right, Richardo.
Okay. I understood
I just went a little deeper, you
I
know.
understood every word you said.
You understood? Oh, tell me what I just said.
The test and treat program.
Yeah. Yeah, you know, fortunately a lot of things, you know, a lot of the words remains the same, like the VIH. It's just, you know, VIH is that it's, you know,
Right.
they'll know what it, when you say that they'll know what it means, but certain words are like the English
Mm-hmm.
language. You know.
All
Yeah.
right. You know, and the final thing is if you need to get tested or you want to know where to get tested, reach out to us, inbox us, message us, or call us, and we'll help you to get connected so you can get an HIV test.
Sou ta reme teste, rele numéro, your number is there, right? Right,
Yep.
okay. Rele numéro sa, yap kapab ede ou, okay, pou kapab jwen non kote ou al teste. Question for you. Or are you done? Let me let you finish with this portion and I have a question.
Yes, I'm done.
Okay. So you would if someone were to call now, you would facilitate the testing process by linking them to a place to test, or because I thought you offer testing, right?
So yeah, so we
Okay.
offer testing, but
Okay.
we offer testing, but we also want to make sure, we're not like trying to hog everybody because that's not what we do, but we want
Mm-hmm.
to make sure that people are getting connected to programs that are close to them. Because I know,
Mm-hmm.
like, we're here in West Palm Beach. If someone reach out to us right now and say, "Hey, I want to get tested, but I live in like Boynton Beach,"
Mm-hmm.
I would rather them go to Genesis and get tested instead of having to figure out how to get here, going through finding transportation and all that other stuff, because I know
Makes
that
sense.
Genesis
Mm-hmm.
offer HIV testing and I
Mm-hmm.
know that they have Creole speaking staff as well. So, those are things that we can do. It's not about just getting people and dumping them in our program. It's about what's best for the client.
Which should be the goal, which is good. But then, you know what I've always been thinking about, though, maybe you, I don't know if it's we can say that on air, maybe you can create that, home test, not send clients or send individual kits to test, like a boss. You go and offer tests, like, and after work everybody's home, you go and friendly gently offer testing.
Of
This,
course.
I was thinking about that. I'm like, that would be what people won't have to go to a clinic. They
Mhm.
won't have to go to a setting, a specific setting. And, I think you'll see a lot of people willing
To do
to take a
that.
test. You
Yeah,
just at their door, you know?
absolutely.
Yeah, yeah. So it's something you should think about
Absolutely.
for
All
your
right.
organization.
Yeah, no problem. Um,
Mm-hmm.
can you tell again, where is it? Just jumping back, I lost my train of thought. Uh, people often feel like they can't trust healthcare providers or like healthcare systems. What would you say to someone who might feel hesitant to go to these things.
Oh no, I mean, I understand, okay? They have a right to feel that way, but you don't have to, because your privacy, your medical information, is protected through HIPAA. Not only that, people can lose their job if you were to. Again, we're focusing on HIV. Let's say someone wants, to be tested, or that result were to be positive. No one can discuss your result with anyone else but you. And the providers, they are obligated to keep your information confidential. Okay? This cannot be shared with anyone else. Even me, when I go to the hospital, even have a poor connection.
Yeah,
Okay? Yes. Um, when I go, I have someone's logs, and we call, the number is not in service, or the person hasn't been responding to calls. We go and knock on your door. We are not, if anyone's home, we are not talking to anyone else but you. Even the note that I leave for my clients, if they're not home, if I'm giving it to someone, just, hey, my name is so and so, any of us, my name is so and so, please give me a call. I mean, in our program, that's what we do. And private providers, they don't go to they don't go to people's home. But then again, even if they were to go, or they can, they don't go. But I'm saying, you go to any healthcare provider, they are required by law to keep your confidentiality. They cannot disclose that to anyone. So you don't have to feel any kind of way. Your information will not be shared. Your diagnosis will, no one will know. It's only you and the provider, your medical team. And by law, they're required to, like I said, protect your confidentiality. So please go get tested, okay? Go get tested. It's better to know, because there are treatments, and like I'm sure you discussed that before on your show. It's not like it used to be before. We all know that. It just, you know, I'm sure whoever's listening already aware of that. I'm just saying, I'm just repeating it. You just go take your medication, and once you take your medication, it's it becomes, so the virus, stop replicating. It becomes so small in your system, it cannot, you become as healthy as someone without it. So yes, please go get tested. And again, the number, call that number if you need help finding a location. Okay? Because we want you to know than not knowing. But when you know, you can make, good decision by starting treatment. Okay?
absolutely. And it's better to know so you can protect yourself and you can
Yes.
protect the people that
Your
you're.
partner. Yes.
Absolutely.
Yes,
Well,
agree.
Linda, thank you for being on the show tonight. This is
Mhm.
really exciting.
Oh, really? Oh, my pleasure. My pleasure.
And it was really good information. And I love my little translation piece right there. One day I'll get there. I'll get there. I'll get there.
Anytime, anytime. I'm here.
All right.
Okay. Thank you. Bye, everyone.
No problem.
Bye.
Thank you guys for watching. Thank you again, Linda. It's been amazing. And stay tuned. Again, if you have any questions or you need any help with finding a provider, whether you live here in Palm Beach County or anywhere in the state of Florida, and you just want to get connected, absolutely reach out to us and we can help you to get connected, help you to find resources that are in your community so you can access them without having to struggle to go outside your community to find them. So we're here for that. We're here to help. And it would be our pleasure to provide you with service. So thank you
Yep.
again.
Great. Thank you. Bye. Bye, everyone. Bye, Richard.
Bye.